Learning outcomes. After studying this module, you shall be able to know the difference between health behavior and health outcomes, learn how poverty and lack of education affect the health of individuals, identify the determinants of health, understand the two-way process between poverty and health and between education and health, learn how malnutrition affects the long-term health of individuals. Health inequalities persist between and within countries, and this module tries to analyze certain determinants of ill health and poor health outcomes for individuals. Specifically, we focus on the role of income, education, nutrition and information. In the context of health economics, the role of these indicators has been studied extensively, and these variables have been found to be significant determinants of health all over the world. The pathways that lead from these linkages to health are direct, have adequate intuitive and theoretical backing, and have been demonstrated amply through empirical research. The following sections analyze each determinant in detail and contribute towards our understanding of perpetuation of health inequalities across regions and sections of society. Poverty and health. Poverty as a direct measure of income deprivation of the people affects the health behavior and health outcomes in many ways. The income deprivation works in many ways to propagate the poor health outcomes in population. Poverty is the root cause of ill health because of lack of access to resources, medical facilities, and lack of adequate nutrition. Low income has been inversely related to the health of individuals. For example, prevalence of anemia, low body weight in children. The lack of affordability with respect to health services and medical facilities also constitute a big reason for ill health among the poor. Indeed, a great variety of research shows that with lower income, the probability of visiting the hospital and primary health center decreases. The lower financial access to other resources such as expensive treatment, costly medicine also contributes to poor health outcomes among people with lower income. These concerns are also extend to morbidity and long illnesses. Poor simply cannot afford long-run treatments without suffering financially. Poverty also adds to disease burden in people on account of poor housing and sanitation facilities. Ample empirical evidence suggests that poor are located in extremely segregated areas of the cities and have almost no access to infrastructure, clean water and hygienic conditions. The infrastructure in poor colonies is also poor, leading to accumulation of rainwater, forming of potholes which become a breeding ground for mosquito and other vectors. Communicable diseases like malaria, dysentery, diarrhea are common in low income neighborhoods. Such neighborhoods are often dirty, filled with garbage, and this contributes further to poor health and adds to disease. Studies from environmental standpoint also contribute to the literature on poverty and health. Poor neighborhoods are more vulnerable to environmental degradation and hence people suffer on account of polluted air and water supply. There is also evidence that the process of dumping waste, including hazardous and nuclear waste in developing countries, is concentrated in the low income areas of the cities. Hence, poverty also renders people vulnerable to exposure to such waste and serious illnesses. Poor also depend upon fuel, wood and cow dung cakes for cooking, etc. And there is evidence that problems associated with breathing and lung infections occur more frequently due to such exposure. In the absence of private incomes, individuals depend more on the public provision of certain goods. Hence, poor are more dependent on public hospitals, healthcare centers for their treatment. For accessing such services, they are also dependent on the public transport system and so on. In such cases, any inefficiency in such services or any delay in provision sometimes proves fatal for the emergency cases. Unnecessary delays in accessing the services can also accentuate the medical problems in certain cases. Poverty leads to poor health indirectly too. Poverty leads to distress migration from rural to urban areas, and it has been noted in a number of studies that migrants have lower health outcomes than natives. lack of stable income, lack of information about local health facilities, lower social contacts, and sometimes discrimination are some of the most common factors linked to poor health of migrants. There is also evidence that health practices like breastfeeding, using safe and clean water, building toilets in the household increase with income. Hence, increasing income of the poor will certainly lead to better health outcomes for the children. Poverty also affects the mental health of individuals. Indeed, higher incomes have been associated with less mental stress and prevalence of depression. It is also said that the poor are more prone to suffer violence and disrespect and hence face greater mental stress. Poverty also works towards lowering the self-esteem and confidence of individuals, particularly when the inequality is higher. Income inequality between various groups also works towards increasing psychosocial pressure on the individuals, thereby leading to greater stress and burden. All of the above arguments suggest that poverty leads to poor health. However, an equally interesting aspect of this relationship is the causality in the other direction. Poor health may lead to lower incomes and hence help in intergenerational transfer of poverty. There are a number of ways in which this relationship can be explained, that poor health leads to less productivity and hence lower income is the simplest and most straightforward way to look at this angle. Contingent on the nature of jobs and health burden, poor sometimes lose jobs on account of ill health. For example, a daily wage laborer cannot afford to keep his or her commitment to the employer on days of sickness. Poor health also leads people to spend a greater proportion of income on medical care and such expenses, thereby adding to the burden on already lower income. There is also evidence of people borrowing to spend on medical care and hence there is greater pressure on finances of the poor for treatment. Hence, poor health contributes towards increasing poverty. Some very recent additions to the literature on poverty and health are the life cycle models, which analyze the impact of childhood health and other relevant variables on the later age outcomes. These studies suggest that children with poor health in early years have lower cognitive skills and earn less than their healthier counterparts throughout their lives. The other ways in which this relationship works is that poor parents have less healthy children and hence they cannot expect to do well in school and get better jobs. Greater mental stress also leads people to work less and have less fulfilling and satisfactory lives. Poor people also suffer on account of job losses due to poor health and so forth. Thus, the relationship between health and poverty is neither one way nor restricted to a single generation. The relationship works in both directions and across generations. Literacy, education and health. Like the linkages between poverty, income and health, the pathways between education and health are varied and work both ways. Education of individuals affect their health and health also affects the education level. There is a lot of research still ongoing about clearly identifying the ways in which these affect work. Direction of impact and exact causal links have not been identified clearly. Prior literature has maintained serious caution in terming their studies as correlation rather than causal. Some of the simpler explanations which suggest the linkage between education and health work from the knowledge of simple routine of hygiene, sanitation and basic nutrition. Educated people are more aware of such health routines and hence carry out such activities in daily routine and hence fall less sick to diseases like diarrhea and dysentery. Such practices work towards improving the immune system and hence people can avoid certain ailments through that route. Educated people also consume healthier food, have healthier routines. A number of studies from developing and developed countries point to the fact that more educated people exercise more frequently and regularly and avoid certain practices like smoking and chewing tobacco and have less probability of falling prey to drugs. Hence, they are healthier. Studies also suggest that more educated people earn better incomes on an average and hence can afford better lifestyle and better medical care. More education also means more access to information and use of information to provide better medical care for themselves and their families. People also get access to better medical insurance plans with more education and hence can cover their medical ailments in a wiser way. Being literate is also associated with less risky behavior. More educated people are less prone to risk behavior for health like consumption of alcohol and tobacco, and hence are lesser at risk for lung and liver cancer. Educated people may be more aware of their genetic predisposition to certain ailments and hence behave carefully and with caution about such diseases. The other direction of the causality, which runs from better health to more education, also has been pursued, but the life cycle models of analysis. Healthier education attends school more regularly, more attentive while attending school, and hence perform better. Healthier children are also found to have more cognitive and language skills. Using height as a measure of cumulative health, studies have demonstrated that taller children grow up to be taller, and healthier individuals have better outcomes for education and incomes all their lives and are expected to live longer too. Aspects of health and literacy also run from one generation to the other. Adults with more education have better knowledge and information pertaining to child health. Thus, the relationship between education and health extends in both directions. Maternal education and child health. When it comes to literacy and health, one of the most prominent relationship is that of maternal education and child health. Maternal education have always been found to be a significant predictor of children's health. The studies which focuses on this aspect of health and education suggest the following causal links to explain this relationship. The health knowledge of the mothers can benefit child health in a number of ways. Educated mother follows healthier diets and lifestyles during and after pregnancy and are more likely to breastfeed the children, thereby leading to better health outcomes for the children. Educated mothers are themselves healthier and hence give birth to healthier children. The third link which helps explain the significance of maternal education to child health accounts for the role of exposure to modern society, which makes women more receptive to modern medical treatment. Literacy and numeracy skills acquired in the school make women more able to diagnose the ailments and treat the children better. The most significant of these factors is health knowledge of the females. In fact, maternal education and child health form a very important component of health and education and are interrelated across generations, and how investing in health and education of women forms an important strategy for poverty reduction and build up of human capital across generations. Nutrition and health. According to WHO, nutrition is the intake of food considered in relation to the body's dietary needs. Good nutrition and adequate, well-balanced diet combined with regular physical activity is a cornerstone of good health. Poor nutrition can lead to reduced immunity, increased susceptibility to disease, impaired physical and mental development, and reduced productivity. The nutrients are divided into two main groups, macro and micronutrients. Macronutrients are consumed in large quantities and are essential for energy, strength, and building the basic blocks of the body. Micronutrients are required by the human body in much smaller amounts and are required for specific purposes in the body. Proteins, carbohydrates, and fats are called macronutrients. Vitamins, minerals are called micronutrients in the literature. The macronutrients form the major food groups and are consumed in greater quantities than micronutrients. Each of the components of this group has a specific role towards determining the well-being of the individuals. Carbohydrates are the main energy and strength providers for body and include cereals, grains, etc. Proteins are called the building blocks of the bodies and are helpful in building tissue and rejuvenation of cells. The fats are a protective cell for the body. Vitamins as a nutrient groups are very essential for proper functioning of certain body parts. Vitamin D, for example, if required for bones, vitamin A for eyes, B complex relates to major function of the body. In the minerals, calcium and ions are essential for bones and blood. Deficiency of iron causes anemia, and calcium deficiency leads to problems of teeth and bones. Hence, each component of diet is important for determining the health of children and adults. Nutrition therefore forms an important component of health. A balanced diet is very important for an individual. Undernutrition and overnutrition. Any imbalance in the nutrient composition of the diet is labeled as malnutrition. Both overnutrition and undernutrition have negative consequences for health. Undernutrition is associated with the lack of work capacity, lack of energy, lethargy and weakness, loss of body weight, retardation, muscle wastage, increased illnesses and reduction of immune power. In addition, undernourished persons get fatigued easily and show signs of psychological distress like stress, lack of concentration, mental apathy, depression and low motivation levels. Malnutrition has severe repercussions in children. According to the UN Standing Committee on Nutrition, malnutrition is the single largest contributor to disease in the world. Malnutrition at an early age reduces mental development and cognitive ability. Studies show that undernourished children have lower school attendance, exhibit poor academic results. They also perform poorly on the ability tests and have lower concentration in class. It also contributes to reduced physical ability. Malnutrition in children leads to stunting and wasting, two indicators of child health characterized by low height for age and low weight for age. Nutrition deficiency in pregnant women leads to low birth weight of children, which is further associated with many other ailments for these children all their lives. Studies have shown that females with poor nutrition in pregnancy have riskier deliveries and cannot produce nourishing breast milk. Overnutrition is the problem of excess intake of food and is associated with obesity. Obesity is defined as the body mass index of 30 or above. The body mass index is the ratio of the weight of individual measures in kilogram divided by the height in meters squared. Obesity is the result of excessive intake of food and nutrients. There are various negative consequences of obesity too. It is highly correlated with problems related to high blood pressure, diabetes and cardiovascular diseases. Obesity is correlated with impaired immunity. In females, obesity is also correlated with fertility issues. There are other psychological problems associated with obesity: low self-esteem, distorted body image, lack of confidence, stress and depression, binge eating disorder are some of the common problems related with obesity. Therefore, adequate nutrition and a balanced diet are the most crucial components of health determination in individuals, and lapse on either side is problematic for healthy lifestyle and functioning. In many developing countries today, the problems of undernutrition and overnutrition exist together. Unequal distribution of income has led to this kind of scenario in such countries. In India, for example, the rates of malnutrition are among the highest in the world, but the prevalence of obesity and other non-communicable diseases is also on the rise. Such situation points towards the dichotomy that exists within the developing countries. Information and health. In the modern world, connected by innumerable devices and techniques, information plays an important role in providing access to healthcare and also affects the health outcomes of individuals. There are various studies regarding how information, either through books, peer circles, social involvement, through technology, helps in transfer of basic medical care and diagnosis in common ailments. There has been a whole lot of expenditure incurred on the government for publicizing the common precautions against a lot of diseases, including malaria, dengue, tuberculosis, AIDS, etc. This happens because information helps in creating awareness and makes people more conscious about health and promotes good health behavior. In recent times, the era of technology revolution, Internet has played a very crucial role in replacing hardcore systems of spreading awareness. Some very recent studies have pointed out the significance of Internet revolution in addressing the informational constraint by the government. Information serves on various fronts on the health system. It provides people with advice about healthy food, building resistance and immunity to simple ailments. It helps in acquiring simple and home solutions to common ailments and helps in the diagnosis too. Thirdly, it helps people get knowledge about the nearest facilities, how to reach them in case of emergencies, how to approach specialized healthcare providers in case of serious conditions. Information also helps in making more informed choices about the right kind of treatment and consultation from various sources. In most of the developing countries where indigenous system of medicine coexist with the modern means, people have often been found to use both systems at various times. People can sometimes be misled by quacks and faulty practitioners, and right information and knowledge helps in identifying and pointing out such faulty practices. People acquire information through various routes: the informal information through social circle and peer groups. Formal channels of information include schooling, education and books. Government initiatives in this regard have been organization of health camps, media campaigns against specific diseases, promoting good health behavior through advertising. In recent time, internet has emerged as a strong provider of information to people regarding healthcare, awareness and prevention. A number of studies in this regard points towards a positive role of the internet. Mobile phones have also been identified as primary drivers of health information access throughout the developing countries. Since the onset of mobile phone technology, transfer of information has become easier and access to certain areas has also become cheaper and easier. All over the world, adolescents and teenagers found to be using mobile phones are more aware and informed individuals and have made the use of this technology and in accessing healthcare and healthcare information. Summary: this module attempts to analyze the role of poverty, illiteracy, malnutrition and information on health outcomes of children and adults. This module clearly outlines the two-way relationship that exists between poverty and ill health. The issue of accessibility gained primary importance when it comes to analyzing health outcomes in the purview of constraints imposed by income. Education and literacy share the two-way relationship with health too. Education and literacy lead to better health outcomes by increasing awareness and making individuals more conscious about their health. Health affects education by increasing cognitive ability and increasing concentration and focus. Nutrition remains an important aspect of the health outcome. Both overnutrition and undernutrition lead to various health problems. Anemia, weight loss, night blindness, loss of energy are some of the common problems related with undernutrition. Obesity, cardiovascular diseases, diabetes are some of the harmful impacts of overnutrition. Information plays an important role in generating awareness about certain diseases and leads to take preventive measure. Certain common ailments can be avoided and even cured by knowledge of simple sanitation and hygiene routine. Certain other aspects of information include getting treatment from the right hospital, getting proper diagnosis for certain diseases, etc. In all, the role of these determinants is crucial to our understanding of health, behavior and health.